There is a renewed call for caution and action as countries across the globe pull themselves to fight another surge in coronavirus, driven by the new variant of Omicron. United Nations Secretary General Antonio Guterres on December 27th warned that infectious diseases pose a clear and present danger to every country. Delhi government has imposed a weekend lockdown, limiting the activity to only essential services being open.
So I think we're going to see an increase, a sudden surge. That is the expectation. So cases are coming in, but most of the cases are mild, and everybody wants to stay at home nowadays. So unless they get severe or oxygen requirement, then only we will start the intake. And even government is not pressurizing for starting COVID beds at the moment because the numbers are less and the symptoms are milder. But yes, we have prepared because we have got our oxygen plant now, so that we are prepared for oxygen. The bed capacity is there, the equipment capacity, everything is there, and we are prepared. But I think we need to prepare more for video consultations. We need to prepare more for OPDs because this is the category of patients which are going to come now, who want consultation, who want video consultations from home.
The valid question is that the third wave precautions is to be by social distancing. Hospitalization is very less in most of the cases. It's just about 4 to 5% of the whole population who are getting hospitalized. So in that interim, government has taken a step to get the patients after 10 jury to get vaccinated are those people who would be above 60. Obviously, इनके immunity levels के ऊपर depend होता है whether they have comorbidities like diabetes or hypertension or any of this sort. Therefore, the government has taken step to get them a booster dose so that they don't become spreaders afterwards. That is why it was more important to get the teenagers and the elderly population to be vaccinated.
Earlier this morning, Delhi Chief Minister Arvind Kejriwal tested positive and urged the people to isolate themselves who were in contact with him. Former BJP Delhi President Manoj Tiwari too has tested positive. There is also a growing spotlight on West Bengal as it topped the COVID positivity rate, with the Indigo Airlines issuing guidelines stating that they are limiting their flights to West Bengal, Durgapur and Bagdogra from Delhi and Mumbai to only Monday and Friday.
The oxygen crisis was certainly there, but I think it could have happened anywhere because of the sheer numbers and the sheer demand. The demand was so much, no government could have managed, And what Delhi government did was quite creditable. But now Delhi government is prepared, and as per the current numbers and the current information that we have from government agencies, I think the oxygen requirement at the moment is not there. Most of the cases, in fact, I think the number of Omicron cases in LNJP, none of them required oxygen, to be honest. But we have to be prepared because it's the at risk or the patients with comorbidities which may require. The normal ones are okay. It's a flu-like symptom, flu-like fever now. But we cannot have our guards down. We have to be prepared.
As you can see, this wave is not about oxygen and not about hospitalization. It is all about spreading. Therefore, it is more important कि सारे जो हमारे दर्शक हैं ये सोचें कि there should be some kind of social distancing, wear your mask, don't go to crowded areas. और जितना हम कम spread करेंगे उतना ही ये virus will not become an endemic.
Amid a fresh surge in COVID cases in various corners of the country, pole-bound Punjab has also reimposed night curfew, while Delhi has gone for a stricter lockdown like restrictions including shutting down of public places, restricting movement, making genome sequencing compulsory for the ones who are testing positive for the virus.
For more such fine stories and video reports from field, subscribe to our channel, The New Indian.